Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Point 12 Natural Endometriosis Treatments. Endometriosis is conventionally treated with pain medications, hormonal therapies, and surgery. However, some people may prefer a natural endometriosis treatment that either complements a prescribed treatment or manages the symptoms of endometriosis on its own. These include supplements, herbs, changes in diet, and alternative practices like acupuncture. /r/n/r/n Though the evidence supporting these remedies is generally lacking, some studies suggest that they can help ease the pain and symptoms attributed to a disease caused by the overgrowth of the lining of the uterus, endometrium, outside of the uterus. /r/n/r/n Illustration by Zoe Hansen for Verywell Health/r/n/r/n Isoflavones are a group of plant-based compounds that may help ease symptoms of endometriosis by blocking an enzyme known as aromatase. Aromatase is used by the body to convert androgens, male hormones, to estrogen. Estrogen, in turn, regulates the growth of the endometrium and contributes to endometriosis when hormones are imbalanced. /r/n/r/n Rich sources of isoflavones include /r/n/r/n A similar organic compound called indoles may also counter the effects of estrogen. It is found in foods like /r/n/r/n Some experts believe that cutting back on saturated fats found in animal products may help lower the risk or severity of endometriosis. Saturated fats are associated with increased inflammation that may add to the stress already placed on inflamed endometrial tissues. /r/n/r/n By contrast, eating fish rich in omega-3 fatty acids and foods rich in polyunsaturated fats, PUFAs, can ease endometriosis pain. Both omega-3s and PUFAs are thought to have potent anti-inflammatory effects. /r/n/r/n A large study involving 70,709 females in the United States reported that the high intake of these healthy fats and a reduction of saturated fats reduced the risk of endometriosis. /r/n/r/n Omega-3s can be found in fatty fish such as /r/n/r/n Rich sources of PUFAs include /r/n/r/n Along with eating fatty fish, you can obtain omega-3 fatty acids from fish oil supplements sold over the counter in capsule form. /r/n/r/n Chamomile has long been used as an herbal aid to calm the body and mind. These same effects may help ease endometrial pain and cramps. /r/n/r/n According to one 2024 study published in the Iranian Journal of Nursing and Midwifery Research, chamomile may help reduce symptoms associated with endometriosis. Patients who took 1,000 mg capsules, 3 times a day, for 8 weeks reported a reduction in pelvic pain, dyspareunia, pain in response to sexual intercourse, and menstrual pain. /r/n/r/n Chamomile contains a compound known as chrysin, which a 2019 study found causes apoptosis, programmed cell death, in endometrial tissues that have grown out of control. The researchers noted that chrysin found in chamomile and other substances like honey may one day lead to the development of novel drugs for endometriosis. /r/n/r/n Probiotics are good bacteria and yeast that keep the natural biome of your vagina and digestive tract in balance. Prebiotics are foods that promote the growth of probiotics. /r/n/r/n People with endometriosis often have an imbalance of microorganisms which probiotics and prebiotics may help correct. /r/n/r/n One 2019 study published in the International Journal of Fertility and Sterility found that 8 weeks of probiotic supplementation with lactobacillus capsules provided some beneficial effects for endometriosis-related pain. /r/n/r/n You can get probiotics through dietary supplements or fermented foods like /r/n/r/n Prebiotic foods include /r/n/r/n Resveratrol is a compound mainly found in berries, nuts, and grape skins. It may help ease endometriosis symptoms by blocking aromatase and enzymes called COX-2 that cause swelling and pain. /r/n/r/n Several small studies have reported that resveratrol supplements can help reduce pelvic pain and cramps associated with endometriosis. Doses of 30 mg, mg, per day reduced pain scores during and between periods by 82%. /r/n/r/n Rich sources of resveratrol include /r/n/r/n Turmeric is a spice that comes from the root of the curcumalonga plant. It contains a chemical called curcumin that has anti-inflammatory properties, which may help reduce endometrial swelling and pain. /r/n/r/n Lab studies in 2018 reported that curcumin was able to slow endometrial cell growth by keeping the body from making estradiol. Estradiol is the most potent of the three types of estrogen produced in the human body. /r/n/r/n That said, more clinical research is needed to confirm turmeric's therapeutic effect on those with endometriosis. /r/n/r/n While generally regarded as safe, the FDA warns that some imported turmeric supplements have been found to contain high levels of lead. To ensure safety, only buy supplements certified by independent bodies like US Pharmacopeia, USP, NSF International, or ConsumerLab.rnrn Acupuncture involves the insertion of small needles in the skin to treat pain and other health problems. A 2017 review of studies published in PLoS One found that acupuncture may help ease pelvic and abdominal pain in women with endometriosis. /r/n/r/n A systematic review and meta-analysis published in 2018 also found that among the approaches studied, only acupuncture notably reduced pain. /r/n/r/n Osteopathic manipulative treatment, OMT, is an alternative form of massage. It involves the hands-on manipulation of different body structures to normalize their functions. /r/n/r/n OMT for endometriosis is typically centered around the pelvis. It employs massage to gently release uterine scar tissues, called adhesions, while easing anxiety and stress that can heighten pain sensations. /r/n/r/n A 2017 review in the International Journal of Women's Health concluded that the benefits of OMT for endometriosis were unproven but acknowledged that it did appear to ease tension and bolster the quality of life of those who used it. /r/n/r/n Herbal formulas are often used in traditional Chinese medicine, TCM, to treat uterine health issues like endometriosis. TCM cites blood stasis as the cause of this medical condition. According to practitioners, lesions form when blood slows or pools in the abdomen. /r/n/r/n A review of studies published in the Cochrane database of systematic reviews found that Chinese herbs fared well when compared to two prescription drugs commonly used to treat endometriosis, dimetrose, gestrinone, and danacrine, danazol. /r/n/r/n Whether taken by mouth or delivered by enema, the herbs proved equally effective in relieving endometriosis pain but with fewer side effects than dimetrose or danacrine. Even so, the studies were small and of relatively low quality, according to the investigators. /r/n/r/n Green tea may be able to alleviate symptoms of endometriosis by blocking aromatase and impeding angiogenesis, formation of new blood vessels. The bioactive compound responsible for this is epigallocatechin 3-golate, EGCG. /r/n/r/n Several animal studies suggest that EGCG can stop the progression of endometriosis and reduce pain and cramping. Although the research on green tea looks promising, more studies in humans are necessary to fully support these findings. /r/n/r/n heat therapy, which is a commonly suggested method for relieving menstrual cramps, may also ease pain associated with endometriosis. Heat can help relieve cramps and pain by relaxing muscles and increasing blood flow to the affected area. /r/n/r/n According to a 2024 study published in Frontiers in Reproductive Health, the most common alternative method used to help with endometriosis pain was heat therapy. Nearly 74% of the 357 study participants reported using a heating pad for symptom relief. /r/n/r/n Arguably, one of the most effective treatments for endometriosis is light exercise. Physical exercise appears to help by strengthening the pelvic floor muscles and easing pelvic adhesions. It can also elevate moods and relieve fatigue, which contributes to depression and increased pain sensitivity. /r/n/r/n Light to moderate exercise may be more appropriate, as high-intensity workouts can add to pelvic inflammation and pain. /r/n/r/n There is no prescribed workout plan for endometriosis, but many experts recommend adhering to the American College of Obstetricians and Gynecologists, ACOG, guidelines for exercises suitable for sedentary women. /r/n/r/n According to the ACOG guidelines, aerobic exercise can consist of any activities that use large muscle groups in a continuous, rhythmic manner, such as brisk walking, hiking, jogging, swimming, cycling, rowing, or dancing. Around 30 minutes of exercise per day on most days of the week is recommended. /r/n/r/n For some people, standard endometriosis treatments may not be enough to manage symptoms. In cases like these, natural therapies may help. These include options such as routine exercise, nutritional supplements, probiotics and prebiotics, Chinese herbs, and foods rich in isoflavones or resveratrol. /r/n/r/n Although these and other natural treatments may help ease endometriosis pain, they need to be used with caution and ideally under the guidance of a healthcare provider. /r/n/r/n Get our printable guide for your next healthcare provider's appointment to help you ask the right questions. /r/n/r/n Sign up for our Health Tip of the Day newsletter and receive daily tips that will help you live your healthiest life. /r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.